Ever wondered about the limitations of monoclonal antibodies? These remarkable biological tools are proteins engineered to interact with specific targets, called antigens, found on the surface of cells. They've revolutionized many areas of healthcare, from diagnosing diseases to treating conditions like cancer and autoimmune disorders. But, like all good things in life, they do come with certain caveats. Most often, we produce these antibodies by immunizing mice, and this is where our first limitation arises. Patients treated with mouse-derived antibodies can develop what's called human anti-mouse antibody or HAMA, which can block the function of the injected monoclonal antibody and even lead to a disorder called serum sickness. We've made strides in genetic engineering to expand the usefulness of these antibodies, but some challenges remain. In the end, even the most advanced molecular laboratories or animal models can't completely eliminate these limitations. So, what exactly are these limitations? Let's explore. The first limitation is the human anti-mouse antibody, or HAMA response. Monoclonal antibodies, a staple in many medical treatments, are often produced by immunizing mice. However, when a patient is treated with these mouse-derived antibodies, a unique issue arises. The patient's immune system might recognize these antibodies as foreign and produce what we call a HAMA response. These human anti-mouse antibodies can interfere with the treatment in two ways. First, the HAMA response can block the function of the injected monoclonal antibodies, reducing their effectiveness. Secondly, it can enhance the clearance or removal of these antibodies from the body, shortening their duration of action. Beyond these issues, the HAMA response can also lead to serum sickness, a reaction that can cause symptoms like rash, joint pain, and fever. That's not all. There's another limitation to consider. The second limitation is the need for advanced genetic engineering techniques. To expand the usefulness of monoclonal antibodies, we turn to these techniques. We isolate the complementary DNAs, or cDNAs, that encode the polypeptide chains of a monoclonal antibody from a hybridoma. In the confines of a lab, we then manipulate these genes. It's a brilliant process, really. We're essentially programming these antibodies to perform specific tasks in the body, to target and neutralize particular pathogens or cells. But here's the catch. These techniques are complex. They require significant expertise and resources. Not everyone has access to this level of technology, and it's not easily scalable. It's like trying to perform a symphony with only a handful of musicians. You can do it, but it's not going to be easy. And that's where the limitation lies. Yet there's one more limitation we need to address. The third limitation is the production of fully human monoclonal antibodies. These are a distinct type of antibody that are completely produced from human cells. The methods used to produce these antibodies are quite intricate and resource demanding. One such method is phage display, a technique that involves using bacteriophages, a type of virus that infects bacteria, to create a large library of antibodies. Another method involves using genetically modified mice that have been engineered to express human B cells. These mice are immunized with a specific antigen, and their B cells, which produce human-like antibodies, are then harvested. Despite the complexity and resource intensity of these methods, the resulting fully human monoclonal antibodies have a significant advantage. They are far less likely to be seen as foreign by the human body and therefore less likely to trigger unwanted immune responses. So as we've seen, while monoclonal antibodies have significant potential, their use is limited by several complex factors.